A warm welcome to everyone joining us for the important conversation on lung cancer, early detection and lifestyle intervention for better outcome. This discussion is an initiative of the Integrated Health and Wellbeing Council and supported by Roche. It comes at a very significant time as November is globally observed as Lung Cancer Awareness Month. Cities like Delhi and several others are facing severe air pollution, re-indicating how crucial lung health has become today. Through this conversation, we aim to enhance public understanding, highlight early detection, and promote preventive care. I am Ms. Samiksha Singh from the Integrated Health and Wellbeing Council, and I will be moderating in today's session. So, today we are joining us by Dr. Yashwant Kashyap, Senior Consultant Medical Oncology, Hemato Oncology, and Bone Marrow Transplant, Balco Medical Center, Raipur. Thank you, Dr. Yashwant, for taking time to be with us and share your valuable insight.
Thank you. Thank you so much.
So, doctor, from understanding risk factor, my first question over to you is, what are the most significant risk factor contributing to lung cancer beyond smoking?
Environmental pollutions and the factory hazards. These are the most significant beyond smoking. And the smokeless tobacco is also a culprit apart from cigarette.
Hmm. Hmm. Apart from this, what do you feel like? What roles does environment exposure, such as air pollution, occupational hazards, play in lung cancer cases?
They play a very significant role, and we have seen in
Hmm.
there are variety of lung cancer like a small cell which occurs
Hmm.
exclusively in smokers. But over the period
Hmm.
in our practice, we have seen 20 to 30% patient now even without smoking they are getting this. All these are due
Hmm.
to environmental pollution, air pollution with factory exposure, some mesothelioma kind of lung tumor occurs due to asbestos exposure, which occurs in factory work. So all these factors contribute giantly for lung cancer.
And what preventive measures should be the public take to reduce these risks?
Like uh, smoking cessation and tobacco cessations are the main most important
Hmm.
risk factor. Though alcohol
Hmm.
is not directly linked with lung cancer, but still we have seen
Hmm.
that at least it is many a time combined with smoking and tobacco. So all this should be
Hmm.
prohibited because we feel very bad many a time that young generations uh, on this old habits, bad habits, leading to early occurrence of all these cancers.
So, how can we better educate people on the early warning signs of lung cancer?
Like most common symptom is cough. So any cough which is prolonged
Hmm.
more than 10 days or 2 weeks, it should be exclusively
Hmm.
evaluated. Earlier, there was notion that every cough is tuberculosis, but due to which we are losing many patients because people are giving them, starting them on anti-tubercular drug for TB drug, but ultimately it turned out to be cancer. So the suspicion should be very high. Any smoker, if persistent cough, prolonged cough, they should be evaluated. Even 30 to 40% occur in non-smokers. They should be also evaluated for cancer if they have cough for more than 10 2 weeks around. And if apart from cough, if they have bleeding in from with cough like hemoptysis or other weight loss and loss of appetite, if all these symptoms are there, then they should be thoroughly investigated.
So, what are strategies which you feel can promote earlier detection, especially for high risk group?
Like some trials have shown that low
Hmm.
dose CT scan, which should be done in patient who are heavy smoker, factory
Hmm.
workers, it can prevent early detection. It can lead to early detection, thus more early stage diagnosis of lung cancer.
Okay. And how can lifestyle changes and preventive healthcare be integrated to reduce lung cancer incidence?
Like I told you that all the smoking habits should be
Hmm.
given, and other the environmental hazards, we should be very much particular about environmental and factory exposures, uh, like smokeless tobacco and every all this things should be avoided, and healthy lifestyle, exercise, rehab, all this. And people should believe on expert, not on the all the random influencers or survivors. Like they should be believing more on doctors, experts who are doing scientific and evidence based research on these topics.
Thank you, doctor. From advancement in screening point of view, there are a few questions which I want to ask. What advancement in screening techniques have had the biggest impact on early lung cancer detection?
Earlier, we had basic X-ray. Now we have
Mhm.
digital X-ray, and apart from that,
Mhm.
the low dose CT scan also is a big gain. Low dose CT, it helps without compromising, giving extra exposure of radiation. It gives early diagnosis in high risk patient. So it is very much effective for chronic smokers or prolonged patient persons with prolonged history of factory working in factory. So all these high risk group, low dose CT scan is a big changer.
How can we increase access to lung cancer screening, particularly in undeserved populations?
Government have now started doing chest x-rays and other screening modules, but still it is not available that much freely in villages. Still it is
Mhm.
restricted to cities only. So
Mhm.
by making more policy towards, because it is more one of the most common cause of death in cancer death in India and in world also. So it should be taken with very strict policies should be formulated so that this dangerous disease can be controlled.
So, are there any new technologies or AI driven tools that show promise in improving diagnostic accuracy?
Yeah, there are some kind of digital X-rays which are driven by AIs, because many a time it become difficult to report the all the X-ray due to a lack of manpower. So AI has facilitated this. AI is also helping us in PET CT, CT scan, MRI, and many things. So slowly, things are getting better and better. And also the when we give treatment in form of radiation, that is also somewhat controlled in some step by AI. So that AI is coming in big way in helping to fight with cancer in a country very diverse and big country like India.
What challenges do healthcare providers face in implementing widespread screening programs?
uh, what happened that there are many a time things like funding, there is issue with funding, there is issue apart from issue with funding, there is issue with like resources or all these are the one of the major issue, like resources, funding, manpower, because we are very diverse and big country, so all these factor matter.
Thank you so much, sir. From progress in treatment perspective, also I have few questions which I want to ask. So the first question is, what are the latest breakthrough in targeted therapy and immunotherapy for the lung cancer?
There are so many drugs. I can name more than 100 drugs. So, lung cancer immunotherapy and targeted therapy is path changer. Every year we get the new molecule, which earlier the expected life of a stage 4 lung cancer in general in older days was less than 6 months, 1 year. But people are living, many of people are living more than 5 years, 6 years. So still, ALK inhibitors and EGFR inhibitor, there are very good drugs, more and more drugs coming. Immunotherapy has come in a big way for lung cancer patient. So things are getting better and better for lung cancer portfolios. So there are so many different class of drug which are practice changing. And though there are some development in surgery and radiation, but the medical oncology, our department with chemo, latest immunotherapy, targeted therapy. It has come in a big way in lung cancer patient.
So, how has the precision medicine and genetic profiling changed lung cancer treatment?
Yes, it has changed the completely. Like earlier, survival was only 6 months, 1 year, or less than that. But things are now much better. People are living for years with this dreaded disease, with better tablets, injections, immunotherapy, and so many things are coming. And hopefully, with government and so many support, cost is also coming down and down. So our approach and more population of India is able to afford this drug.
Thank you so much, sir. I also want to know what does the future look like for personalized treatment and how can patient access these innovation therapies?
Future is very bright, but the only issue still is future is very bright because so many good drug coming at affordable rate. Only issue we see that our focus is still on more on treatment, but most of the patients are coming in advanced stage. Screening program still needs a lot of upliftment so that a major burden, cost burden, and GDP burden on health can be decreased. And government and setup should be focusing more on the prevention apart from facilitating this newer drug to all the population so that the survival become uniformly better for lung cancer patients.
Right. Sir, from multidisciplinary and holistic care, I also have few questions which I want to ask. So the first one is, can you discuss the role of multidisciplinary care in managing lung cancer patients?
Yeah, it is like I am trained from Tata Memorial Hospital. So there we practice the multi because cancer is a systemic disease and it takes the help from we need help from surgeons, from radiation, from radiologists, from pathologists and nuclear medicine. So many person because it needs a complete setup decision and every life is precious. So it become MDD decisions are many a time path changer and very much fruitful for patients and any uh, almost I think most of the cases should be discussed in MDT so that patient get the standard uh, quality of care and evidence based care.
Thank you so much, sir. And how do we ensure patients receive the psychological support they need throughout their treatment journey?
Yeah, we are trained like all the medical oncologists, surgeon, radiation from big centers. They are already trained in maintaining patient psychological well-being also. And apart from this, we have also palliative medicine department, a strong palliative medicine department also. All this help us because cancer is not for single patient's disease. It affects family in some way. That's why now over the period we have evolved, we try to manage patient, we treat patient as a whole, and we always support the family also with all the support we have through social group, through peer group, through different palliative medicine referrals, through all across all the group. They are many of our patients are like our friends.
And would like to also know like what improvement can be made in patient education to help them better understand their diagnosis and treatment options.
Like many due to this generation people are still influenced by the non-scientific thing circulating in media, so they should be focusing more on expert talks, the evidence-based talk and good institute. They should be always a critical thinker that and they should be following the guidelines, like they should be it should be like unnatural things or non-scientific things they should not believe directly. Many time people don't want to hear, sometimes people don't want to hear truth, so whatever they say that you can be cured by this simple tablet or something, they believe it easily and they get carried away. They don't complete their treatment because many a time cancer treatment is prolonged or even if they are getting good they differ from surgery, differ from radiation or chemo, or they break that after 1 2 months they stop the course. So there are many things which it is a long continuous process, and over the period the whole oncology is evolving. So slowly compliance and everything will be better and better.
Sir, moving ahead, I also want to ask how can caregiver and healthcare systems work together to improve patient quality of life?
Focusing on all these parameter, first they should be discussing MDT. Patient should receive the standard of care so that patient becomes symptom free and his disease remains in control. Apart from that, uh, if patient is very frail, we don't give him strong chemo or something which can alter his quality of life. We choose our drug, we use the drug which will lead to more survival for patient. We don't just see that give a toxic drug with survival. Like we want good quality of life for our patient also. We don't, like if patient is some teacher or something, we don't say our patient that you take 6 month leave and sit in home. We always tell, encourage them that join your duty, be productive to all the group, do your complete work which you are doing. So there is no restriction for them for doing work.
So, from the advocacy, awareness, and policy support, I also have few questions. So, the first one is what are some examples of successful patient advocacy initiatives that have improved outcomes?
There are so many examples. There is one, like there are so many uh, good examples. Great people have done, leading to the all the our star cricketer and all. There are many. One Australian cricketer, he has done good work for cancer patients, and leading he had advanced stage disease in brain also. Then also he get cured from testicular tumor. So all this many good NGOs and support teams are coming who are helping our hospitals and our system, because cancer is not a disease which we can fight alone. We need lot of support, lot of patient advocacy group. There is lung connect group which is associated with Tata Memorial. They are doing very remarkable job and very good job for cancer patients. They are making patient to live a complete normal life, more productive life. With They are doing an excellent job for patient care. They are just removing misleading things from the society also.
Yeah, and thank you. And how do we break the stigma associated with lung cancer, especially among non smokers?
Yeah, there is lots of stigma. People think that without smoking and all, I have got all this. What crime I have done? Why God is unfair to me and like this thing. But over the period, things are changing with targeted therapy and immunotherapy. Patients are living longer, better, with good quality of life. So they are doing much better.
A very thoughtful answer, sir. And also, we want to know what can policymakers and government do to enhance lung cancer awareness and prevention efforts?
They should be apart from awareness for prevention, they should be stopping or banning tobacco and smoking, because that is the biggest culprit and which is causing major burden. And other the air pollution things they should be controlling, and the routine like regular x-rays and low dose CT for high risk group, this should be implemented. They should be spending more on healthcare, because health, we as a doctor many a time feel that health is very much neglected in our dear country.
Thank you so much, sir. I also want to know what role can public-private partnership play in driving lung cancer awareness on a larger scale?
They can do a mini partnership through various X-ray machines or low dose CT machines. Through partnerships, they can be implemented, and in various factory and other screening programs, and all this can be conducted. which can lead to early detection. Because in my, uh, I think around 10 year of practice, stage, early stage patient, I have seen less than 5-10%. So almost 90% patient in our Chhattisgarh area also, they are stage 4 patient. So it become very difficult that we are getting all advanced stage only, even after so much some awareness about lung cancer. Still more than 90% lung cancer are diagnosed in stage 4.
And so, how can we advocate for more funding and resources towards research and affordable treatment?
No, but there are many government schemes like Ayushman Bharat, and so many schemes are there. Pharma companies are also coming with patient assistance program. So things are much better compared to 4 year back. But still, there is a prediction that apart from cardiac and diabetes, cancer will be the biggest thing in next 10-15 year. So we should be preparing for that battle also. So things are getting better with Ayushman Bharat and many things, but still there is lots of unmet need where government need to boost up.
So I also have a few questions from bridging gaps in care. So the first one is, what are the main challenges in diagnosing and treating lung cancer in low resource setting?
Low resources like many a time the CT scan and basic things are not available, or person who is
Mhm.
trained in doing biopsy, they are not available. But things are getting better and better over the year. More good trained persons are coming, so hopefully future is bright for Indian patient. Just funding and all will be a big issue, because cancer is coming in big way, so much population of ours.
Thank you, sir. And moving ahead, how can public health initiative bridge the gap in care between urban and rural areas?
Yeah, it needs, because many patient in rural area, they are getting treatment very late, and if support program and other are there, then they can get the standard of care treatment in local nearby place, in good multi-specialty or cancer hospital like we have. So holistic care they can get in near place only, instead of waiting, or instead for waiting for starting treatment, they can get treatment very early in nearby place, because many a time treatment is prolonged.
Also, I want to know what role does telemedicine play in improving lung cancer outcome in undeserved regions?
Still, many centers like we have Jagdalpur and distant far area, there radiologists are reporting the CT scan based on images. Still, so that is a big way, but hopefully, government has increased now so many PG seats. More and more doctors are coming. So telemedicine still has a role for undeserving, but over the period, the need will be like more systematic, and telemedicine is a big role, because many patients are our diagnosed early. Earlier they were not able, they cannot come always to Raipur or other big cities. So uh, getting telemedicine is a big help for our patients.
So, any take home message which you want to give for our public who are hearing this?
Uh, I just want to say that we have so many, don't fear from cancer, fight with it. So many new drugs, newer therapies are coming, that we have so much options for our all the patients. And uh, uh, take treatment in a center which is equipped with all the latest cutting technologies, which is now coming even in tier 2, tier 3 cities. So take cancer is a standard treatment, so take it in a good center equipped with all facilities.
Thank you, Dr. Yashwant, for your invaluable insight. Conversation like this play a crucial role in empowering the public with knowledge, breaking stigma, and encouraging timely health seeking behavior. Together, through awareness, early detection, and collaborative action, we can make a significant impact on lung cancer outcome. Thank you so much, sir, for your time.
Thank you, Sakshi.